Tickle, tickle, tickle. He is a very relaxed little guy. It's almost like he's like, I've been through some stuff, and this is nothing.
The little guy who's been through some stuff is Elliot, the one between his brothers, Frank and Ian. Less than 5 months ago, Elliot had major heart surgery. His care at American Family Children's Hospital started months before he was even born, with a multidisciplinary cadre of expert caregivers.
So we had the initial anatomy scan, and Ian and Franklin checked out great. They looked great. And then I knew it wasn't good when 3 doctors came in after the scan and sat down and said, I think we need to get your husband on the phone.
To move forward and then have this next set of information, which is Elliot's heart, transposition of the great arteries. It was like, wow, now we've really got something to work for and work hard at.
Transposition of the great arteries is a life-threatening heart defect where the 2 main arteries of the heart are reversed. Elliot also had a hole between the lower chambers of his heart. He would require major, complex surgery shortly after his birth.
Think about delivering a baby and how emotional that whole experience is. Newborn baby, you're so excited, and then all of a sudden to realize that your baby has a critical heart defect, that now you have to understand the fact that he needs surgery, the lifelong implications. It's a lot of information. Whereas if you have prenatal diagnosis, we tell you the same thing, but you have the time to prepare.
The amount of stress that was taken away from us because we could have these conversations with these people, they could answer our questions.
See, this is his pulmonary arteries.
When we met with Dr. Srinivasan, she would so thoroughly explain everything that I felt I knew exactly what was wrong. She always drew diagrams.
She took the time every single meeting to recap what was wrong with Elliot.
Dr. Srinivasan and an entire team of caregivers developed a plan for a successful birth of the triplets. Now the next step. Dr. Petros Anagastopoulos and his team closed the hole and repaired the arteries in Elliot's heart.
Getting to meet with him and hear about all of the procedures that he's done and his success rate, and getting to hear about all of that, and just knowing we're in really great hands.
You have to flip the great vessels, but you also have to move the coronary arteries, and that's the difficulty of this operation. If you get that right, then the physiology of the kid is for the most part fixed, and they do very well.
After we got through the surgery, I felt like I could breathe again. Because there were definitely some days in there where we just had no idea if he was going to make it out of the hospital.
Elliot's surgery went well. He'll have a cardiac team with him through adulthood. His long-term outlook is excellent, and there's a great chance he may not need surgery again.
Seeing my wife so happy after what she's accomplished, seeing my older son kiss his baby brothers, and seeing each one of them smile, it's worth everything. It's worth all the hard work.
I definitely want him to be aware of everything he went through, and I kind of want to tell him, you're a survivor. You can do anything, because look at what you did by the time you were 8 weeks old.